to reduce the clutter on your table, you need a direction. So something like Prepladder gives us that direction. You have some 40 hours or 50 hours of gynecology.
I have given all the content of pharmacology.
I've contributed the entire content for internal medicine.
I have created the content for PSM.
You can trust the questions and explanations to be genuine.
Detailed explanations will help you solve the different variations of the same question.
Textbook references will help you authenticate an answer.
I have created this content after close inspection of the previous year questions.
I have put in my 14 years of experience into creating these questions.
Includes the latest exam questions, questions on the recent updates, as well as image-based questions.
All questions are according to recent exam trends and difficulty level.
So the software would be exactly like the real exam.
All your queries come directly to me.
So if you have any kind of doubt, you can ask me directly.
I'll be solving all your microbiology related queries.
You can ask anything about the subject, doesn't have to be only about a question.
I'm always available for you whenever you need help.
You can have a counseling session with me.
So we've put in features to make sure you keep studying. The Prepladder app will never let you fall behind.
Solving obs and gynae questions will be easy for you after this.
You would not have to worry about anatomy at all.
You will be able to solve most of the questions in PSM.
Most pathology questions in the exams are going to be derivatives or the repeats from these questions.
1 lakh competitors.
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 It's good to see that everyone in the team is giving their best.
This is the best team of faculties that could have been put together.
This is the biggest innovation in medical education.
We are obsessed with making sure that you get the best value out of every minute spent on the Prepladder app.
Really happy to be a part of Team Prepladder.
You know, if there was something like Prepladder when I was preparing, I'm sure that I would have prepared much better because I would have known what to read.
Now we are going to discuss very important topic, and that is aneurysm. Nowadays, lots of questions are being asked in exams about aneurysm. So first of all, what is the definition of aneurysm? So the definition of aneurysm, it is the permanent and irreversible dilatation. Permanent and irreversible dilatation. Of blood vessel with at least 50% increase in diameter. So it is permanent and irreversible localized dilatation. It's the permanent and irreversible localized dilatation of blood vessel with at least 50% increase in the diameter. There is a second word which is known as ectasia. In ectasia, dilatation is going to occur, but there is increase in diameter less than 50%. So what is ectasia? Ectasia is the dilatation of less than 50% of normal diameter. So these two are the basic definitions. We will keep on using these terms. After that, lots of one-liner questions are asked. Lots of one-liner questions are asked. What are those one-liner questions? First, what is the most common site of aneurysm? So most common vessel involved in aneurysm. and that is circle of Willis. First question. Second question, what's the most common site of extracranial aneurysm? So have a look. Most common site of extracranial aneurysm. That is infrarenal aorta. Followed by iliac artery, followed by popliteal artery, followed by femoral artery. So second question is asked, what is the most common site of peripheral arterial aneurysm? And answer is hidden here. So most common site of peripheral arterial aneurysm. And that is popliteal artery. Question is asked that what is the most common site of splanchnic arterial aneurysm? Most common site of splanchnic arterial aneurysm, and that is very important, that is splenic artery. Splenic artery. After that, question is asked, most common site of mycotic aneurysm. Mycotic aneurysm means infected aneurysm which is caused by bacterial infection. So most common site of mycotic aneurysm, and that is femoral artery. And after femoral artery, it's the aorta. So most common site of mycotic aneurysm is femoral artery followed by aorta. So these are one-liner questions which are asked. After that, what's the most common cause of abdominal aortic aneurysm? See, in majority of cases, it's the degenerative. And what's the most common cause? Atherosclerosis. So most common cause of abdominal aortic aneurysm, that is atherosclerosis. One simple question is asked, the risk of rupture. Rupture is the most common and most fatal complication of abdominal aneurysms. So risk of rupture depends on which particular condition. So risk of rupture is mainly determined by width or diameter of aneurysm. So risk of rupture depends on the width or diameter of aneurysm. That's why there are certain cutoff diameters where we are supposed to perform the surgical repair in the aneurysm, and these are frequently asked questions. So cutoff diameter, which is an indication for surgery. In cases of aneurysm, first, descending thoracic aorta. Descending thoracic aortic aneurysm. The cutoff diameter is more than equal to 6.5 centimeter. This is maximum. More than equal to 6.5 centimeter. But be careful, in patients of Marfan syndrome, in cases of positive family history, connective tissue disorders, bicuspid aortic valve, and aortic stenosis. In cases of Marfan syndrome, positive family history, connective tissue disorders, bicuspid aortic valve and aortic stenosis, this is more than equal to 6 centimeter. It means it is less than 0.5. So be careful and read the question carefully. Sometimes questions are asked that what is the cutoff diameter in patients of Marfan syndrome for descending thoracic aortic aneurysm. It is 6.5 centimeter. After that, abdominal aortic aneurysm and ascending aortic aneurysm. Abdominal aortic aneurysm and ascending aortic aneurysm. The cutoff diameter should be more than equal to 5.5 centimeter. Third is iliac artery aneurysm. Iliac artery aneurysm. In this case, it should be more than 3.5 centimeter. After that, popliteal and femoral arterial aneurysm. In this case, it is more than equal to 2 centimeter. So you have to remember in this sequence, maximum is for descending thoracic aorta, that's more than equal to 6.5 centimeter. For abdominal aorta and ascending aorta, it's more than equal to 5.5. For iliac artery, more than equal to 3.5. For popliteal and femoral, it is more than equal to 2 centimeter. So see what happens in aneurysm. Have a look. This is a vessel, and what happens? There is dilatation of this part of lumen. How much diameter? At least the increase in diameter should be at least more than 50%. So this is known as width or diameter, and I told you the risk of rupture is dependent on width or diameter. Now in this case, if intima, media and adventitia, if all the three layers are involved, this is known as true aneurysm, and it is known as pseudo aneurysm if all the three layers are not involved in the dilatation. So see the definition. First, true aneurysm, when all the three layers of vessels are involved. Second, pseudo aneurysm or false aneurysm, when aneurysm does not contain all the three layers. So this is the basic definition. After that, I told you mycotic aneurysm. What is the mycotic aneurysm? It's the infected aneurysm. So mycotic aneurysm is infected aneurysm, and be careful, it's a misnomer. Actually, it's caused by bacterial infection. So it is infected aneurysm caused by bacterial infection, and the most common organism responsible is Staph aureus followed by Salmonella. We will discuss it later. After that, next is dissecting aneurysm. Dissecting aneurysm. In dissecting aneurysm, there is dissection, aortic dissection with aneurysmal dilatation of false lumen. So this is dissecting aneurysm. After that, have a look. There is fusiform aneurysm. Now what is this fusiform aneurysm? In which there is symmetrical enlargement. Symmetrical enlargement involving whole circumference of artery. After that, very important, saccular aneurysm. Saccular. This saccular aneurysm affect only one part of arterial circumference. Affect only one part of arterial circumference. And be careful, irrespective of diameter, this saccular aneurysm is having high risk of rupture. Most of atypical aneurysms are having high risk of rupture. So saccular aneurysm, irrespective of diameter, is having high risk of rupture. Sometimes these definitions are asked in exam. Now we are going to discuss in detail abdominal aortic aneurysm. Nowadays, frequently this topic is being asked in exams. So, abdominal aortic aneurysm. First question, what's the most common site of abdominal aortic aneurysm? That's infrarenal aorta. What's the most common site of atherosclerosis? Again, that is infrarenal aorta. So, what is the most common cause of abdominal aortic aneurysm? Obviously, atherosclerosis. These are three very important questions. Have a look. First question, most common site of abdominal aortic aneurysm, and that's infrarenal aorta. Second question, most common site of atherosclerosis, and that is what? Infrarenal aorta. So third question, most common cause of abdominal aortic aneurysm, yes, and that is atherosclerosis. Right, now see what is going to happen in cases of abdominal aortic aneurysm. See, this is the aorta, especially infrarenal aorta, and there is degenerative condition, that is atherosclerosis. Because of this degenerative condition, what happens? There is increase in the diameter of aneurysm. And what is the natural course of aneurysm? Can you see? There is progressive increase in the diameter. I told you the most important predictor of rupture of aneurysm is what? Width. So see, the natural course of aneurysm is continuous expansion. So there is continuous expansion or increase in diameter. Next, very important point, most important predictor for rupture, and that's width or diameter. Width or diameter. Now see, when patient is going to develop aneurysm, what are the symptoms? Most common symptom is chronic backache or dull aching abdominal pain. This is the most common symptom. So most common symptom in aneurysm is abdominal aortic aneurysm is chronic vague abdominal pain or back pain. Why? Because of location of this aneurysm in retroperitoneum. Now, what is the most common and most lethal complication of aneurysm? The most common and most lethal complication of aneurysm is rupture. So, most common and most lethal complication of aneurysm is rupture. This question is frequently asked. Now can you see, on the right side of aorta there is inferior vena cava. So actually aorta is on left side. So if this aneurysm is going to rupture, what's the most common site? Aorta is located in the retroperitoneum. So the most common site of rupture is what? Can you see? It is the left retroperitoneal. This question was asked many times. So, most common site of rupture is left retroperitoneal. This question was asked left retroperitoneal because on right side there is IVC and aorta is mainly located in the retroperitoneum. After that, questions are asked that what's the triad of aortic aneurysm rupture. So have a look. The triad of aortic aneurysm rupture is first, sudden onset, mid-abdominal or flank pain, plus shock plus pulsatile abdominal mass. So the classical triad of aortic aneurysm rupture is sudden onset of mid-abdominal or flank pain plus shock plus pulsatile abdominal mass. But be careful, it is not seen in all the cases. It is seen in 1/3 of the cases only. So it is seen in 1/3 of the cases only.